The Minister knows that I've spoken about these issues in relation to dentistry with her, I think, on several occasions now, and have written to her as well. And I'm writing to the Treasury about these issues this week because, as she rightly points out, she is a champion for public health and dentistry and pharmacy and other issues. But there is a cash problem here as well. So I will be writing to the Treasury about these issues as discussed with her. I'm also aware that she is doing her best in difficult circumstances, and COVID presents a unique set of circumstances. And I agree with my right honourable friend from Mole Valley that under this minister, we are seeing an improvement, or should be once COVID gets lifted. However, there are issues being faced by islanders in relation to dentistry. It is frankly just very, very difficult, nigh on impossible in some parts of the Isle of Wight for families to find an NHS dentist. I thank the Minister for the extra money to soak up some of the outstanding appointments, but that money was reasonably limited and it went very, very quickly. Some islanders who are getting new dentists are now having to go to the mainland for treatment, which is incredibly inconvenient, especially with the most expensive ferries in the world. We have kids on the island, some of whom who've never seen a dentist in their life. The Health Watch England report, 7 in 10 people are finding it difficult to access an NHS dentist. In 2019, the same body published data which showed that 85% of dental practices across the country were closed to new patients. That is absolutely reflected in my constituency. And as well as the inconvenience, as well as the damage to the dental health of the nation, as my honourable friend from Mole Valley has suggested, this is also causing us, or going to be causing us, problems in the longer term, because we know there is going to be a significant rise, potentially in cancer cases. And one of the side effects of a lack of dental appointments is that we're not going to be able to spot cancers and ill health when they show themselves in people's mouths, like mouth cancer as well, but also gum disease is associated now with heart disease. We know that. So there is a knock-on effect in other bits of the health service. And my worry is, as with pharmacies, and as I've discussed with the Minister, because we have got a cash flow problem in these areas, that is going to exhibit itself in greater problems and frankly more expensive problems further down the line. Dental practices are facing issues clearly before COVID. The challenge is in part a workforce one. So the British Dental Association found that 75% of dental practices are struggling to fill vacancies. Over half of newly qualified NHS dentists under 35 are thinking of leaving the NHS in the next 5 years, with many going into private practice. It's good they're staying in dentistry, but it is bad that they're leaving the NHS, because the NHS is now where we need the acute dentistry support. And dental schools, the nearest to us being in Portsmouth, are not producing enough dentists. These problems seem to be exacerbated in coastal, rural and isolated areas. Now, we're isolated by being cut off from the mainland by the Solent, and we're also coastal and we're also pretty rural. So on the island, we are experiencing these factors worse, arguably, than many other parts of Britain. And also on the island, we have an issue with dentists retiring or leaving, which is specifically the case amongst several, and will put our system under even greater threat. I've talked on numerous occasions now, not only to NHS dentists, but also to specialists working in dental labs on the island and indeed elsewhere. There's no easy fix to these problems, but there are some potentially reasonably quick wins. And I just want to mention a few now to see if I can interest the Minister in them. So the initiation of a dental training scheme on the island would be incredibly helpful and would deal with one specific hotspot. And if you train here, there's nothing to stop you then going back to the mainland elsewhere. So it's not like we're only going to be training dentists for the Isle of Wight. It would be good if we were, but if we have an overflow of dentists, no reason why dentists can't go back to the mainland after the training. Can we have a simplification of the process for qualifying as a training practice and a boost to the funding for the salaries of interns? We're not talking about significant amounts of money here, but these are going to pay dividends in the long run. I do think, according to people who are much more expert in this clearly than I am, changes to the contracts to incentivise remaining in the NHS is important, and also separation of laboratory fees from dental fees will help laboratories survive as well. Finally, just on the issue raised by the my honourable friend from Mole Valley, fluoridisation. I do think this is a no-brainer, and I do think it is very difficult to make a case against it. The minister was kind enough to grab a coffee with me, I think it was last week or the week before, to talk about public health schemes. This is a scheme that, if she is looking for a test case, could be very easily brought in to an area of the UK which is highly measurable because it's separated by sea from the mainland. And clearly I'm talking about my constituency in this case. We are self-contained. We only have one local authority, one water authority to deal with. And so if there was a desire to have another pilot scheme for fluoridization, or for pilot a rollout, that could be done very successfully on the island. And considering we are having dental problems, considering we do have a shortage of dentists on the island, may I respectfully suggest that if there is going to be a move to fluoridization, as the honourable friend from Mole Valley was rightly suggesting, that please start where arguably it is most needed, which is on the Isle of Wight. Thank you very much indeed.